Good morning to our distinguished guests, colleagues, and of course our public health advocates who are here with us this morning. Today, as you would recognize, we are gathered to discuss the topic of immense importance, tobacco harm reduction and its role in the WHO Framework Convention on Tobacco Control, the FCTC. Tobacco use, I want to emphasize, continues to be one of the leading causes of preventable diseases and death worldwide. And despite our own progress, over a billion people, I should say, still smoke globally, with millions succumbing each year to diseases which are directly caused by tobacco use. My views, they are significantly impacted from a confluence of experiences which a moment ago would have been outlined by Robert. Firstly, I'm a medical doctor by professional training, practiced for many years with several clinics in St. Kitts and Nevis, and also in Trinidad and Tobago, where I did my own internship. Secondly, I spent many years as the Prime Minister with lead responsibility within the Caribbean community on matters pertaining to health and, well, health issues, I would say. Thirdly, I've had the opportunity to work with the Bill Clinton Foundation, where we were able to successfully spearhead the Caribbean region's approach to HIV/AIDS. And that, of course, was at a time when there was great uncertainty with regard to the economic development and future of the 15 Caribbean territories of the Caribbean community, and when we were trying to map out an economic development path in the middle of this pandemic, most of our countries, of course, being tourist hospitality-related services. Therefore, it was my considered view that as we review the principles of the WHO FCTC, it's essential to recognize harm reduction as a core element in our fight against the tobacco epidemic. Harm reduction, I emphasize, is not compromising our commitment to reducing tobacco use. Rather, it is a pragmatic, science-based approach that complements existing tobacco control measures by minimizing the health risk for those who are unable or unwilling to quit. At the core of this approach is a recognition of the dignity and the humanity of every single smoker, addict, or user, I would say, of tobacco. Let me look at a few important areas. Firstly, how do we define harm reduction for our context? Harm reduction refers to the public health strategies that are aimed at minimizing the negative health impacts of behaviors that pose significant risk to us. In the context of tobacco control, harm reduction focuses on reducing the harm caused by smoking, particularly for people who continue to use nicotine despite understanding the risk of smoking. The WHO defines harm reduction as policies, I quote, policies, programs, and practices that aim to reduce the health, social, and economic harms associated with the use of harmful substances, end of quote. For tobacco, this means promoting less harmful alternatives to smoking combustible cigarettes, such as nicotine replacement therapies, the NRTs, e-cigarettes, and heated tobacco products. Let's be very clear here. The best option for health is to quit smoking entirely. However, we must also acknowledge that quitting is incredibly difficult for many of our smokers. Harm reduction provides a critical alternative for those who are not ready to quit but are willing to switch to less harmful nicotine delivery methods. Secondly, let us look at harm reduction within the WHO context. The WHO Framework Convention on Tobacco Control, adopted back in 2003, was a landmark achievement in global public health. Its goal was to reduce the devastating consequences of tobacco use, of course, through a set of coordinated strategies, including taxation, advertising bans, health warnings, and smoke-free environments. While the FCTC primarily focuses on prevention, cessation, and protection from tobacco exposure, harm reduction is implicit in several of its articles. And for example, I quote, Article 14. It encourages governments to promote cessation programs and support people who want to quit smoking. Harm reduction tools, such as e-cigarettes and nicotine replacement therapies, fit squarely within this framework, offering smokers options that reduce their own exposure to harmful chemicals found in combustible tobacco. Article 9, I make reference to as well. It speaks to the regulation of the contents of tobacco products. Harm reduction plays a very crucial role here as it encourages the development and the promotion of less harmful alternatives, such as heated tobacco products or low nicotine cigarettes. Thirdly, let us look at the science behind harm reduction. Research clearly supports the harm reduction potential of non-combustible nicotine products. According to Public Health England, vaping is estimated to be about 95% less harmful than smoking. Similarly, heated tobacco products, which heat tobacco rather than burn it, produce significantly lower levels of harmful toxins compared to the traditional cigarettes. Back in 2019, there was a study published in the New England Journal of Medicine. It found that smokers using e-cigarettes were nearly twice as likely to quit smoking as those using traditional nicotine replacement therapies like patches and, of course, gum. These statistics, they underscore a very critical point. That is, harm reduction strategies, when implemented effectively, can save lives of real people. The goal should not be protection or perfection, but rather incremental improvements in public health outcomes by offering people less harmful alternatives. Let us look fourthly at acting on harm reduction policies. To fully realize the potential of harm reduction within the framework, we need to adopt specific policy and action steps. Here, are several key areas to focus on. One, acknowledging the continuum of risk. Not all tobacco nicotine products are created equal. The harm caused by smoking is overwhelmingly driven by the combustion of tobacco, not the nicotine itself, is what the science says. We must embrace the continuum of risk by recognizing that products like e-cigarettes and heated tobacco products, while not completely risk-free, are far less harmful than combustible cigarettes. Secondly, regulating reduced risk products. Harm reduction requires careful regulation to ensure that reduced risk products, they are safe, effective, and accessible to current smokers. Governments should really regulate e-cigarettes, heated tobacco, and other alternatives in a way that balances the need for safety with the need for access. This includes product safety standards, clear labeling, and restricting marketing, in particular to our youths. Another important measure is taxation and incentivization. It is a considered view from an international trade perspective that differential taxation can be a powerful tool to be used. By taxing traditional cigarettes at higher rates than reduced risk alternatives, governments can really create economic incentives for smokers to switch to less harmful products. Countries like the United Kingdom, like New Zealand, have already implemented these strategies with considerable success. Looking at public education and health campaigns as well. Public health campaigns must communicate the relative risk of different tobacco products very, very clearly. It is not enough to tell smokers to quit. We need as well to educate them, educating them on the harm reduction options that are available to them, ensuring that smokers understand the reduced risk of products like e-cigarettes and nicotine replacement therapies can encourage them to make safer choices in this regard. Equitable access to harm reduction also is a consideration. Harm reduction must be accessible to all populations, including low-income communities and marginalized groups who suffer disproportionately from tobacco-related illnesses. Governments should ensure that harm reduction tools are widely available and affordable as well, particularly in regions where smoking rates are high. And so it is on this element of a harm reduction-based strategy that we need serious action. This requires, like so many other challenges of a global approach, it is in this area that the Clinton Foundation, in particular, assisted Latin America and the Caribbean in its fight against HIV/AIDS. Finally, addressing some concerns and challenges. I am not at all naive to the complexities of this issue. I understand that harm reduction strategies can be controversial. Critics often express concern about the potential for youth uptake of e-cigarettes or the perception that harm reduction normalizes nicotine use. However, these challenges are not insurmountable, and they should not prevent us from acting at all. Strong regulation and oversight can mitigate these particular risks. By setting age restrictions, by regulating marketing, and ensuring product safety, we can, in fact, protect our youths while still offering safer alternatives to adults who are smoking. Our goal is to reduce the harm of tobacco, not promote nicotine use. And so, in closing, harm reduction is not at all a compromise. It is a critical and compassionate part of tobacco control that recognizes the reality that millions of people continue to smoke, despite knowing the risks. The WHO Framework Convention on Tobacco Control, it gives us the tools to address this particular challenge, but we must act with a comprehensive strategy that includes harm reduction at its core. We cannot afford to ignore the evidence before us. By embracing harm reduction as a core component of the framework, we could save millions of lives. We can reduce healthcare costs, and we can create a future where far fewer people suffer from the devastating consequences of smoking. Lessons, of course, from Sweden, from New Zealand, and the Czech Republic are worth replicating around the world, especially in low and middle income countries and small island states like mine. New Zealand dramatically cut smoking rates among youth, adults, and the indigenous population through enhancing access to the THR products, particularly vapes. This success is relevant for small island states with high male smoking rates more than 35%, such as in Tonga, Solomon Islands, Cyprus, and the Maldives. Sweden, it leads the world in closing in on a 5% national smoking prevalence rate. Swedish success attributed to widespread use of nicotine pouches as alternatives to toxic cigarettes. We must be careful, however, to conduct research into local circumstances that will enable us to frame solutions fit for varying economic, socio-political, and of course, cultural instances. Solutions engineered for high-income countries, such as the United States, will solve the problem across the entire globe. Let us work together. Colleagues, let us work together. Let us work together to ensure that harm reduction becomes a driving force in our own global fight against tobacco, helping us in the process to move closer to a smoke-free world. Thank you all.
Thank you.